Good afternoon, and welcome to our presentation on safe skin during COVID-19. We apologize for the technical issues earlier, but we're glad to have you back listening now on a different platform. So we'll begin by introducing ourselves. My name is Dr. Stephanie Frankel.
And I am Dr. Nicole Neuschler.
And we are board certified dermatologists and owners of a private dermatology practice in Denver, Colorado called Core Dermatology. We are both proud medical dermatologists, which means we specialize in skin cancer screening and detection, as well as treatment of numerous other inflammatory and infectious skin disorders. We want to begin today by thanking the Melanoma Research Foundation for this opportunity to speak directly to the public about keeping your skin safe and healthy during the COVID-19 pandemic. For those of you who do not know, the Melanoma Research Foundation is an organization whose mission is to support melanoma advocates, patients, caregivers, and survivors. Given limitations during this pandemic, the MRF has launched April 30 and 30, a month-long campaign that features virtual events that will bring the melanoma community together to raise $30,000 in 30 days to support 10 research grants for innovative medical students in order to help them advance in the melanoma research field. Their research could lead to a future breakthrough and ultimately a cure to melanoma. If you have any questions for us, we won't be able to have a live chat box, but please reach out to the Melanoma Research Foundation or Core Dermatology directly, and we will do our best to answer them in a timely fashion. So, we wanted to start by discussing how COVID-19 has impacted dermatology. Like most people in the world, dermatologists have been deeply affected by this pandemic. Early on, as businesses around the country and world began to shut down, people pondered, is dermatology essential? And as we all know, of course it is. Dermatologists diagnose and treat skin cancers. We treat uncomfortable and occasionally life-threatening rashes. We identify and treat infections and can recognize findings on the skin that are clues to underlying internal illnesses. But as our world rapidly changed during the month of March, we as a community realized that our practice did also need to evolve. Many of you may have noticed announcements on your dermatologist websites or may have gotten emails or phone calls stating something like, so-and-so dermatology is available for virtual visits. We are only seeing essential, urgent, and high acuity patients in the office. The reason for this is that most dermatologists are currently following guidelines set out by our National Academy of Dermatology, the CDC, the World Health Organization, and our government. These guidelines state that all non-essential or elective medical and surgical services should be reduced or offered telemedicine services irrespective of their exposure or symptom status. By doing so, dermatologists are helping in two ways. We are flattening the curve by minimizing exposure to patients, staff, and physicians, and we are also helping preserve personal protective equipment and redirect this equipment, such as gloves and masks, to our physician colleagues who are on the front line daily. So, how have we proactively been helping our patients while still adhering to these difficult guidelines? So our first focus has been on outreach and education, events like this today where we can help empower our patients to care for their own skin. We're also shifting more towards telemedicine, using it as triage, and we even have opportunities to do remote mole analysis, which we'll review with you today. And finally, we're remaining available for urgent conditions if possible. Our goal is to keep people with skin disease and problems away from urgent care centers or emergency departments.
So many of you may be asking, what if I need a routine screening during this time? Guidelines strongly recommend that any preventative visits, screening, or routine wellness examinations should be postponed during this time. Even patients with a history of skin cancer should be encouraged to first see their providers virtually before coming into the office. So what can you do in the meantime? You can start by checking your skin at home and doing your monthly self-skin examination. You will need the following: a full-length mirror, handheld mirror, blow dryer, room with good lighting, and perhaps a chair or stool. So here are the steps that you should take to do a good examination at home. Doing it in a systematic method, with a systematic method is best. First, examine your face. Carefully inspect your nose, lips, eyelids, ears. Remember to use the handheld mirror for the back of your ears. Examine your scalp. Use a blow dryer to expose all areas. You may need a friend or family member to help examine the back of your scalp. Examine your upper body. And when you're doing this, when you're examining your hands, don't forget about your fingers, fingernails, palms, on your arms, elbows, upper arms. On your lower back, use the hand mirror to examine there, as well as use the floor mirror in combination, and use the hand mirror to help with the back of your neck. Then examine your lower body. Don't forget to see areas such as the buttocks, soles of the feet. You may need to sit to examine the back of your thighs and use the handheld mirror for your genitals. And don't forget, if you have nail polish on, to remove it. Now may be a good time. And when you're checking your feet, check between your toes, under your toenails, etc. Here's a nice image from the American Academy of Dermatology of people accessing hard to reach areas using both the hand mirror, floor mirror, and a chair if necessary. So now you know how to look. The next step is what to be looking for. What does melanoma look like? So many of you may have heard of the A, B, C, D, and E before. And here it's listed nicely, and there's a nice schematic. A is for asymmetry. One half is unlike the other half. Border, irregular, scalloped, or poorly defined border. Color, often very variable. It can have shades of tan, brown, black, sometimes even white, red, blue, purple even. Diameter, while melanomas are typically greater than 6 millimeters, the size, i.e. the size of a pencil eraser, when diagnosed, they can be smaller. And then E for evolution or evolving, a mole or skin lesion that looks different from the rest or changing in size, shape, or color. For example, here you can see this evolving from probably a 2 or 3 millimeter to probably a 5 or 6 millimeter lesion. And of note, the Skin Cancer Foundation, their current campaign is called the Big C. In addition, you should remember in addition to the A, B, C, Ds, and Es, to look for things that are new, changing, and unusual. And in addition to melanoma, there are a few other skin cancers to watch out for that are actually more common, although far less dangerous. We aren't going to focus on them today, but you should be aware that there are non-melanoma types of skin cancer, such as basal cell carcinoma, squamous cell carcinoma, and there's also Merkel cell carcinoma. We aren't going to focus again on them today, but in general, if you find anything that's painful, itchy, bleeding, or generally new or different, please reach out.
The next slide is here to make a very important point. Take a good look. Any idea what unifies these lesions? Well, they're all benign, completely harmless, but they're very intimidating looking, and they may be new, they may be changing, they may be unusual, or even symptomatic. The point is, we don't expect you to know this. In fact, many physicians in other fields might not recognize that these are benign findings either. It takes years of training to become a board-certified dermatologist. A good dermatologist will never think you are wasting their time or asking a silly question. All day long, I tell people, I would rather take 30 seconds to reassure you that something is benign than ever have you guess at home and guess wrong. Ultimately, if you do forget everything we've said today, the main take-home point is, if you find something on your skin and it looks different from everything else on your body, please show it to a dermatologist.
Which brings us to the next subject. You may be wondering, how can I safely show something to my dermatologist during this pandemic? Luckily for all of us, technology is now assisting dermatologists and patients all over the world. So what is teledermatology? It's a subspecialty in the medical field of dermatology where phones, computers, or other devices are used to exchange medical information in order to diagnose and treat various skin ailments. This field of medicine has existed for years, but there were two large barriers to widespread use. One, insurance would not cover these visits, and two, we were limited by the lack of HIPAA-compliant technology platforms. Now, thanks to relaxation of certain laws due to COVID-19, most insurances, including Medicare, now pay for video visits exactly the way they would cover an in-office visit. Additionally, we're able to use almost any form of video communication, including Skype, FaceTime, Zoom, and specially designed HIPAA-compliant platforms. When it comes to moles and concerning lesions, the main benefit of telemedicine is triage. It helps physicians to determine which lesions might need to be evaluated further. If something looks concerning online, we have two options. One, many offices remain open to handle circumstances like this. Two, we have a very cool and exciting option to evaluate lesions at home using a pigmented lesion assay, or PLA. DermTech is a company that has developed a pain and scar-free adhesive patch that can identify malignant changes on a genomic level that cannot be seen clinically or by a pathologist. The test can identify melanoma at its earliest stages, which increases your chance of being cured. Using small stickers, skin cells are collected from the mole and submitted to a lab where they are analyzed for the presence of specific genes commonly found in melanoma. This is a test we have used in clinic for years, but as a response to COVID-19, it is now available to patients in their homes.
This slide shows the science behind the test. If you look at the bottom, you'll see a mole evolving from a benign lesion on the left to invasive melanoma on the right. Now look at line 3, where it mentions PRAME and LINK gene expression. As a mole evolves into melanoma, you will see that the cells start to express these two genes. These are the genes that the DermTech test is looking for. Both are involved in cancer genesis, and they are elevated in melanoma. They can appear even before the mole starts to change clinically. Based on this diagram, you can see no benign lesions express these genes, while many invasive melanoma express both genes. And then in between, you've got atypical or evolving lesions that may express one or the other of the two genes. The purpose of this slide is essentially to tell us that the test is excellent for screening melanomas because very few melanomas will be missed. If the test comes back as negative, meaning neither gene is expressed or identified, that mole truly is not a melanoma. If either or both genes do come back as positive on the test, then we would know that an urgent visit for the mole to be evaluated and potentially removed in office would be necessary.
So how does this actually work at home? So here I have listed the steps from 1 to 7. So first would be the initial virtual visit with your dermatologist. Then your dermatologist recommends and orders the DermTech kit. The kit is then delivered to your house via FedEx. And then you have a follow-up virtual visit with the physician and or the staff member for specimen collection, so they can easily walk through how to do this specimen collection at your home. Then you can drop your specimen in a FedEx box. The results are received and reviewed by your dermatologist, and then you are reassured or you follow up in clinic as indicated. This is what will arrive at your house. There's a FedEx box, or excuse me, a FedEx envelope that you'll bring to the box. There's alcohol, gauze, a collection, labels. It's extremely easy to use. And in the next slide, we have the instructions. These are the same ones that would come to your house. And on DermTech's website, they have a very nice short video explaining how this is done in the office, but also now at your home. It takes about 5 minutes from start to finish to do this adhesive tape on the mole. It's very simple. It's like putting Scotch tape on the mole. Remember, no cutting, no pain, no scars.
But lots of good information. So now we've discussed what to look for, how to look for it, and how you and your doctor can work together to best diagnose and triage lesions on your skin. But there's one final and essential piece of education we'd like to touch on, which of course is how to prevent a skin cancer from forming in the first place. Melanoma, the most serious form of skin cancer, is characterized by the uncontrolled growth of pigment-producing cells called melanocytes. 70 to 80% of melanomas appear on normal-appearing skin, while the rest will develop from an existing mole. Most frequently, we see melanomas on the upper back, torso, lower legs, head, and neck. More than 1 million Americans are living with melanoma, and although there are more common skin cancers, the vast majority of skin cancer deaths are from melanoma. Currently, we estimate there'll be around 200,000 new melanoma cases diagnosed and over 6,800 deaths this year alone. However, this is not all bad news. If detected and treated before they reach the lymph nodes, melanoma have excellent prognoses. If caught early, the 5-year survival rate is close to 99%.
So who gets melanoma? Melanoma can strike anyone. Genetic risk factors include having greater than 50 moles, having large atypical moles, family history of melanoma, fair skin, red hair, and or light eyes. Chances also increase significantly if you've already had a melanoma, but also increase if you've had either a basal cell carcinoma or a squamous cell carcinoma. Your risk for melanoma also may be increased if you have had other cancers such as breast or thyroid cancer. Sun exposure is the most preventable risk factor for all skin cancers, including melanoma. One study found that 86% of melanomas can be attributed to exposure to UV radiation from the sun. A person's risk doubles if they have had over 5 sunburns, and just 1 blistering sunburn in childhood more than doubles your chance of melanoma later in life. For this reason, reducing your skin's exposure to UV radiation from the sun is essential. Unfortunately, we cannot change our genetics, but we can change our behaviors.
So this slide reviews how to change those behaviors. First, seek shade when appropriate, remembering that the sun rays are strongest between 10 a.m. and 2 p.m. A good rule of thumb is that if your shadow is shorter than you are, seek shade. The second big behavioral modification is to wear protective clothing, such as long sleeve shirts, pants, wide brimmed hats, sunglasses where possible. A wide brim hat is a good way to create shade for your face and neck, and wearing sunglasses can help avoid skin cancers that occur in the eye. In the coming years, we anticipate a significantly greater focus on this strategy. There are a lot of newer, elegant fabrics that have UPF protection, manufactured by many of our major brands. So when buying things for the beach or just taking a hike or a walk around the block, look for clothing that has a UPF 50 label. Finally, for skin that can't be covered, a water-based broad-spectrum sunscreen with at least an SPF of 30 or higher should be applied to all exposed skin 15 minutes before going outside. Reapply every 2 hours or after swimming or sweating. Higher SPFs have been proven to be more effective in recent years, and by wearing a daily sunscreen, you can reduce your risk of melanoma by 50%. So here's just a few images of our friends and family going ahead and practicing these behavioral changes, seeking shade, covering up, and wearing sunscreen when necessary.
And some of this was reviewed above, but to reduce your risk of skin cancer, generously apply sunscreen to all exposed skin 15 minutes before going outdoors. This is a review of what some of the things we discussed above, but remember, broad spectrum, SPF 30 or higher, water resistant or very water resistant. Most adults need about 1 ounce or enough to fill a shot glass to fully cover their body. Don't forget your lips can get sunburned too, so apply a lip balm that contains sunscreen with SPF 30 or higher. Sunscreen should be reapplied approximately every 2 hours or after swimming or sweating. Sunscreens rub and wash off, so if you've towel dried, please reapply sunscreen for continued protection. Ultimately, this is a personal preference as to whether you'd use physical or chemical sunscreen. Either offer excellent protection if used properly, as already discussed. We won't delve more into sunscreen today, as we could do an entire talk about that. But just remember, there's physical as well as chemical sunscreen, and the most important thing is using it.
So, we hope we've helped you today to feel a little more educated and empowered to watch over your own skin as we navigate these very unusual and challenging times. We also hope that we have helped you to feel more comfortable with the new role that technology is playing in the world of dermatology. We're going to end by veering off of the subject of melanoma for just a moment. Given the fact that COVID-19 is what has brought us all together virtually today, we did want to mention a few skin-specific findings related to this viral illness. In the beginning of the talk, we mentioned that one of the essential roles that a dermatologist plays is to identify skin findings that may be signs of internal disease. Well, for those of you who have not already seen this on the news or on social media, dermatologists have begun to notice and report skin signs related to COVID-19. These are not specific to COVID-19, but they are certainly suggestive of COVID-19 when diagnosed in these times. Many of these rashes are occurring in young, generally asymptomatic patients who have absolutely no idea that they were exposed or that they may have COVID-19. This is important because many of these individuals are the asymptomatic shedders that you've heard so much about, who may be unwittingly and unknowingly spreading the virus throughout their community. On the next slide, there's a couple of photographs of some of the findings that we're seeing most often. The first are the so-called COVID toes, painful, itchy, red, swollen digits. And then lividoreticularis is a lacy, sort of red rash that comes and goes on the lower extremity. If you or someone you know is experiencing any of these symptoms but is otherwise feeling completely fine, they should still reach out to a dermatologist virtually for assessment. We can help with some of the symptoms and also help by counseling you in terms of how to proceed. These individuals should consider themselves to have COVID until proven otherwise. And given the lack of testing that we have available, self-quarantine for 14 days is generally recommended.
We thank you for listening today, and thank you again to the Melanoma Research Foundation for finding creative and engaging ways to support advocates, patients, caregivers, and survivors of melanoma. We hope that you will all consider supporting their mission to fund research grants for innovative medical students working in melanoma research. Once again, if you have questions, please direct them to the Melanoma Research Facebook page or the Core Dermatology Facebook page, and we will try and answer them as soon as we can. Thanks so much for listening.